My name's Associate Professor Stuart Marshall. I'm an anaesthetist in Victoria, Frankston Hospital, and also work for the University of Melbourne. I started off my training in the UK and then had a couple of years in New Zealand at Waikato Hospital, and then ended up moving to Melbourne eventually. I've been an anaesthetist for about 20 years. So I kind of see anaesthetists as the kind of batteries in the hospital that powers everything. There's a lot of things that wouldn't happen in the hospital if anaesthetists weren't involved, and people don't really necessarily know all of the breadth of what we do. We could be down in the emergency department sorting out some pain relief for somebody. We could be in the intensive care unit doing airway management, intubation. We could be on the labour ward. We could be in the pain clinic. There's so many different things that anaesthetists do. But unfortunately, like batteries, we are often forgotten about until we're not there. We're often the people that are called for to sort of energise a situation. I explained to them that anaesthesia is one of the safest things in medicine. We have a very proud history over the nearly 200 years of our specialty of improving safety. Indeed, we're really a model for safety of other areas of medicine. It's incredibly safe to go under anaesthesia, and although there are risks, those risks are mostly able to be managed. What makes a good anaesthetist? I think someone who is compassionate and cares for people. I think someone who is curious and wants to have the knowledge as to how to be a better anaesthetist, whether or not that's in day-to-day work or whether or not that's in research and trying to help other people provide better care. And also someone who has the skills, not necessarily just the physical hand-eye coordination skills, but also the communication skills and the people skills. We have such a huge variety of things that we do. We look after the very youngest people and the very oldest people. We look after the biggest and the smallest people. We look after people from all the different specialties in acute care and chronic illness. And I think just the variety of what we do and where we can find ourselves is just exciting. So my interest is in helping people manage emergencies when they occur, which they do occur very rarely. And generally what that means is having the skills, the communication skills, the non-technical skills we call them, for them to be able to come together and manage all of the resources they have in their environment. And we do that through giving them prompts, having particular methods of going through things with cognitive aids or aid memoirs, and also teaching them in a simulation setting, so in a lifelike setting, as to what an emergency would look like and how they might, giving them some feedback about how they might do things differently.